Pastors Chooks and Toyin Ogoye. Pastors Chooks and Toyin Ogoye are the lead pastors of Resurrection Life Church, Johannesburg, South Africa. They are passionate about building families and raising men and women who transform and uplift the standard of life in their communities through understanding and applying biblical principles. Pastor Chooks and Pastor Toyin frequently host workshops, seminars, and conferences for transformation. Some of their programs include Kingdom Financiers Conferences, Dream Achievers Conferences, Marriage Enrichment Courses and Seminars, for wives-only seminars, Single Ladies Boot Camps, and Limitless Men Seminars. They are the founders of the Power of Women Academy, a group mentorship for high-impact women, and host the annual Power of Women conferences and amazing Power of Women broadcasts. For more information, please visit www.idelight.co.za and www.reslife.org.za or WhatsApp +27 814 210 835.
Good evening. Welcome to another episode of the amazing Power of Women broadcast, brought to you every Thursday, where we share about the amazing power that God has given each woman for you to understand it, for you to experience it, for you to, harness it and use it for the glory of God. I am Pastor Toyin Ogoye, and this broadcast is based on the book that Pastor Chooks Ogoye wrote, The Amazing Power of Woman, where revelation about who you are, who God really says you are, and just teaching around that. And we speak to three aspects of a woman: her spirit, her soul, and her body. So this broadcast every Thursday deals about the different things that the woman goes through and just brings revelation, understanding around who she is, who she truly is, as God has called her, helping each woman to understand the amazing power that God has given to her. And once a month, on the last Thursday of the month, we speak to her regarding her body, how to take care of her body. And so we have what we call Ask Your Gynae sessions every last Thursday of the month. And we have a resident gynecologist, Dr. Gugu Gamedze, who comes and she just helps us explain different aspects of what a woman goes through. She's a specialist gynecologist, and she's able to bring understanding around the different things that the woman goes through. Even for a child, as soon as the child even is starting her period, we've done different sessions around, premenstrual care, different things around fibroids, different topics that we have taken on this last Thursdays of the month. And today she's going to be teaching on antenatal care. What do you need to know, and whatever it's required for you in that period. So I just want you to share this broadcast. If you're watching us, share this broadcast with a friend, with a sister, with someone around you who this information will be most appropriate for at this time. They could be going through planning to have a baby. They just got news that they are pregnant and all of that, and so it's important for them to know what to expect and how to walk through that journey. And so we would have Dr. Gamedze join us shortly. Do have a beautiful one with us today. God bless you.
Dr. Audrey Gugu Gamedze. Dr. Audrey Gugu Gamedze is a medical doctor by profession, a specialist consultant in obstetrics and gynecology. She runs her own private practice where she helps and serves women from all walks of life on a daily basis. She has a heart for women because she identifies, by virtue of being a woman, a sister, a mother, a wife, a daughter-in-law, and understands the journey of a woman, and is still passionate about wanting to learn more about women. She is a born-again Christian medical practitioner. She sees her medical practice as a powerful ministry platform, an opportunity to touch and transform the lives of women and their families to the glory of God. Dr. Gamedze features monthly on our Ask Your Gynae show at the Amazing Power of Women broadcast, where she helps women understand the female body and how to care for it. She's the mother of 2 children and has been married for over 22 years.
Good evening, dear listeners and dear viewers. Welcome again to another session of Ask Your Gynae. A special word of gratitude to my pastors, Pastor Chooks and Pastor Toyin, for this platform where I can come and impart what I know very well, a woman. On this episode, we will be discussing antenatal care. Ask Your Gynae is a session that recurs on this platform every Thursday, the last Thursday of the month. So welcome and thank you very much for tuning on. Antenatal care. What is antenatal care and why is it important? What does it differ? Does it alter the outcome? If it is incorporated into the life of a pregnant woman or the life of a woman or the life of a family, does it have any value? Let's start off by saying that pregnancy is a family affair. It attracts not only the family, the community, and if it is well nurtured, it actually influences the outcome of a nation. If I were to be a pastor, I would share from what Samson did. Samson's mother was told how to eat during the pregnancy. When the baby is delivered, what to do to the baby and what not to do. And what did the Israelites get? A mighty man. So let's put ourselves down to it. Now, I'm a gynecologist. I'm going to tell you about what I know very well. Antenatal care basically means care of a pregnancy. It has got two aspects that a woman needs to know. The first part is preconception, and the second part is the actual care of the pregnancy. Why are we bothering about preconception? If the packaging is well maintained, we are sure that what it will be carrying is going also to be safeguarded. So it is important that a woman who is planning a pregnancy or a family that is planning a pregnancy knows that the actual woman who will be carrying the pregnancy is well taken care of. Also, age is important because with age we get certain disease profiles that creep in which needs now special attention. So if I were to define preconception care, preconception is said to be a set of interventions that is aimed at identifying and modifying 1. biomedical, 2. behavioral, 3. social risk factors, aiming at preventative and managerial intervention of the pregnancy and outcome. That sounds so long and scientific. But what we are saying is, during pregnancy, we want to know your biology. During preconception counsel, your biology. Does it allow you to be pregnant? Does it allow you to carry a pregnancy to 9 months? And then medically, are you well? Do you have disease conditions that need treatment before you start the pregnancy, during the pregnancy? And do those disease conditions affect the baby in the sense that are they transferable or not? And then when we talk about behavioral, there are mothers who are smokers, there are mothers who are drinkers, there are mothers who are into business that affects their sexuality. So risks of infections are very high. But because I'm talking to mothers in church, I am going to keep it in such a way that there is an expectation of a certain conduct for women who are called by the name of the Lord. And then those who are still outside, we are inviting them to come in. Okay. And then social, we want to know, can the mother afford to carry the pregnancy? If there are any needs, financial needs, will they be catered for? If there are any social circumstances in the house, like some mothers are in abusive relationships, emotionally they are not well. Are there any factors that we can modify? Will you be able to take transport to get through to your health care center, taking into consideration, of course, the distance from your clinic center to your house and vice versa. So that is what preconception will look into. So preconception will present the actual planning. Some mothers are on medication that needs to be changed because it's not compatible with pregnancy. Other mothers are into habits that needs to be stopped before we start a pregnancy. Other mothers have got excessive weight which needs to be shed before you fall pregnant. So preconception will attend into all of that. Who does preconception counseling? When is it indicated? So we live in a modern society now where families can plan their pregnancies. So we reach a point where we feel that, okay, maybe in the next 6 months we would like to try and have a baby. So that's the good window to now consult with either your healthcare provider, who could be a midwife, who could be your general practitioner, who could be your gynae, or any other healthcare person. Some people do homeopathy, they do chiro, but most of the health fraternities have got crucial information. And if you need to be prayed for, you consult your pastor. So there's a lot of avenues where we can reach out to get the information. So what are the levels of care that are available in South Africa? We've got primary health care, which will be the nursing area that is closest to you. It could be a midwife station. It could be just a normal clinic that's run by ordinary nurses, not specifically midwives. There you can get preconception counseling. And then if there is something that they feel needs attention of a doctor, they will refer you to a secondary level, which will be a hospital where you will find a doctor. This could not be necessarily a specialist, but just an ordinary doctor, your GP. So that will be the secondary level of care. If the doctor finds it fit that you need to be taken care of in a tertiary level, that is where there is a specialist obstetrician, then you'll be referred to that level. Other people have got specific needs which need to be managed at a quaternary hospital. That's the last number in South Africa, where now you'll find, say, maybe a gynecologist who is a specialist for, say, maternal medical conditions. So that will be the last number where you will be managed. Let me make an example. Say you've got a specific heart disease that you are on treatment for. It's not any gynae that can take care of you. You will need to be taken care of at a quaternary hospital, where you will be managed by an obstetrician who has a special training in cardiology with a cardiology medical doctor. So that is very, very important. So how do we access such areas? It is very important that as a mother-to-be, you know in your vicinity who is available to take care of you. I've had a very interesting scenario where ladies of mature age will say, when I was 18, I fell pregnant. I hid the pregnancy for 9 months. I delivered a normal baby behind the door. There were no complications. So why is it that in this pregnancy, I need to be taken care of by a doctor? And why do I need to be followed up so often, and so on and so forth? Let me just say, the woman's body was created for a premium age. So the premium age of fertility is the late teens, which is around the age of 18, up until around the age of 30. That will be the premium age. So anything that happens in that age, the body is able to take care of. But nowadays, we've got specific problems. Number one will be nutrition. We are so overnourished that oftentimes we carry babies that are far more bigger than what our bones of the pelvis can let out. So you find that somebody who delivers an unattended pregnancy is more likely to suffer more complications than it was 40 years ago. Also, you find that we pursue career a lot and start our families very late. A typical doctor is likely to start her family after the age of 30, for an example. And if you haven't met the right partner at medical school, you are most likely to start your family towards the age of 40. By that time, you have already attracted specific medical and genetic disorders that need attention during the time of the pregnancy. So the specific tests that need to be done to rule out infections, to rule out genetic disorders which can be transferred to the baby. So I'm still trying to invite you to say that care from a healthcare perspective during the planning of a pregnancy and in pregnancy is very, very important. The other thing that is an advantage if we undergo preconception care or preconception counseling is that we get assessment of risk factors. I've alluded to a few of them. Other people, you find that they do not have the complete anatomy to carry a pregnancy. Let me make an example. There are ladies who get to a certain age and they've never achieved menarche. That means their periods have never started. That needs to be investigated. And oftentimes you find that that particular lady does not have a uterus. If that person does not know that they do not have a womb, or if they do have a womb, it is so small to carry a baby, it is underdeveloped, that can make a marriage unpleasant. There are also people whom you find that the eggs of the woman are a mixture of testicular tissue and the egg tissue. That woman will never be able to fall pregnant naturally, although she will have all the secondary signs of maturity of a woman, although she may have her period, but she may not be able to fall pregnant. So if that has gone uninvestigated, it is likely that that family will spend a longer period of time trying to fall pregnant. The other group will be ladies with concomitant anatomical disorders like big fibroids, ladies with extremes of endometriosis. If you do not have a preconception counseling and assessment, those illnesses may go underdiagnosed and hence delay the time to start a family. So please, ladies, let's talk about it and let's make sure that we are informed about our bodies. Let's make sure that we do encourage each other to go for preconception counseling. The other example, of course, will be ladies who are epileptic. Epilepsy is one of the common conditions, oftentimes diagnosed in infancy, and those ladies stay on medication better part of their lives, and also the medication may be increased in dosages, increased in diversity of drugs. those drugs are not compatible with pregnancy, most of them. So we need to change that kind of drug first, see if you are controlled, and then you can start falling pregnant. Otherwise, it's guaranteed that the baby will have abnormalities, because anti-epileptic drugs are very, very teratogenic. That is, they are dangerous to the baby. So that covers why preconception counseling is important. The second part of my talk is antenatal care. Now, the actual care of the pregnancy. Most likely this part I will introduce, say a few words on it, and then complete it on the next time. Me and you are still gonna meet in this platform again. So, the actual pregnancy, when should one start going to the gynae or to go to the clinic? Number one, in our South African health system, because it is so loaded, you find that most mothers are advised that you do your pregnancy test at home. If it is positive, you wait until you're around 4 months or so, then you can come to the clinic. If you are less than that, you will be just taken the history and then sent back to come back when you are around 4 to 5 months. That is very, very late. The reason why in the government we do that, it is because of the workload, and also the access to healthcare is very narrowed. But because you are on this platform, I'll advise you by saying this. As soon as you miss your period, as soon as you do that pregnancy test and you find it positive, find either your GP or your gynae. Reason for that, number one needs to check, where is that pregnancy? A pregnancy that is not located in the womb is very dangerous to the life of the woman. If you've got an ectopic pregnancy, you are most likely to die from it. So an undiagnosed pregnancy is as dangerous as a snake in the house. So it's important that we time our periods. We can see when we've missed a period, and as soon as we miss a period and you do a pregnancy test at home to confirm that you're pregnant, you make your way to see your doctor so that at least a preliminary scan can be done to locate that pregnancy. So pregnancy is classified into trimesters. Traditionally, a pregnancy was 42 weeks. That means that the first 14 weeks form the first trimester, the second 14 make the second trimester, and the last 14 make the third trimester. But because pregnancies are so much surveilled, or they are of so much interest, we have discovered that actually the last 2 weeks are the most dangerous to every pregnancy. Number one, the babies are born over mature, what we call post-maturity syndrome, meaning that they have overstayed in that oven. Number two, most pregnancies are lost at that time. The loss of those pregnancies are mainly due to placental insufficiency. So God put that plate called the placenta. The baby eats optimally for 40 weeks. After that, then we do not know whether there's enough food, there's not enough food. So the contemporary pregnancy is now 40 weeks, meaning that the trimesters are now a rough estimate. So the first 12 and a half weeks become your first trimester, and then from 28 weeks going up, we call that your last trimester. Anything in between is the second trimester. So issues around the first trimester involve, number one, screening for infections, screening for blood pressure, finding the location of the pregnancy, and also screening for genetic or chromosomal abnormalities. Let me unpack further what is it that I mean by this test. Let's start off with the infections. Specific infections that we screen for during pregnancy. Number one, it's HIV, because it is curable, and also we know that if it is not taken care of, it is transmissible to the baby. So you will be tested for HIV infection during your pregnancy. Number two, it is syphilis. Syphilis, although we have dealt very well with it through lifestyle and also the use of antibiotics, we still see traces of it here and there. And if it affects a mom during pregnancy, it is most likely to give us a baby with abnormalities. So syphilis will be tested. If it is present, it will be treated, and you will be so kindly asked to share the treatment with your partner. So it is important to be in good terms during pregnancy, because there's a lot that you will share. The other infection that is routinely screened for, especially in the private sector, is hepatitis. Hepatitis is disease of the liver. Some mothers will be carriers, meaning that they got the infection, it is not affecting them, but can be transmitted or can affect the baby. So there is screening for hepatitis. The other powerful one is German measles or rubella. There is screening available for that. If you get infection in the first trimester, it's not bad at all. But if you get it during the second trimester, it is most likely going to affect the baby. So most women walk around having vaccinated against rubella. That is a vaccination that we normally get at school, primary school or secondary school when we hit puberty. So what will be tested is how much antibodies or how much soldiers do you have in your body. So if you are positive for rubella, we want to know, is it the long-term standing soldiers or it's the active fighting soldiers? So that will be tested. The other thing that we look for is the chromosomal abnormalities. This is usually put up as a choice screening. Due to the litigation in South Africa, most gynaes, you find that they do push that you do the screening for chromosomal abnormalities. When I pack it or reduce it to an understandable level, I say, we've got three types of families. We've got the ones that want to know so that they can do a medically indicated abortion because they don't want to take care of a baby with special needs. We've got the second family that will say, you know what, I just want to know now so that I prepare myself. Whether this baby has got abnormalities or not, it will still be my family member. I'll take care of the baby. And then we've got the last team that will just say, the grace of God is sufficient. I don't want to know anything. Can I cross the bridge when I get there? Whether the baby has got abnormalities or not, it is still my baby. When we look at how many families understand what they mean, we find that when the baby is born and the baby is presenting with those specific challenges, most families feel like, if only I had known, I would have done a research, I would have prepared myself better. So if you are a mom of a mature age, starting from the age of 35, it is mandatory to do the test. Then the other age groups, less than 35, it is a nice to know test, but these genetic abnormalities are now distributed throughout the age groups, so it is important. The other thing that we get to know, of course, is our blood group. Blood group carries a lot of information about the compatibility of the pregnancy. The most specific one is the rhesus group. So that's why they will say blood group whatever positive or blood group whatever negative. So if you are negative, you are much more of a high risk mother than a mother who is blood group positive. The reason for that is because most of the males are positive. So if a positive meets the negative, most likely the baby will take the blood group of the father. So if the baby is blood group negative carried by a positive mother, there is a risk that the baby gets what we call blood group incompatibility with the mother. I will unpack that as we proceed about the care of the woman. So for people who would like to say do further interventions, it is easier to do it in the first trimester than in the last trimester. Then in the second trimester, we also do a set of tests, which I will dwell on the next episode. And then the last trimester, it's when we try and focus more now towards the final day. So what are we saying? Antenatal care involves preconceptional care, counseling and screening, and also care of the actual pregnancy. Please do tune in for the next time, because I am going to tell you more now what happens in your visits and what should you expect. What we are going to discuss here will make sure that you get out, you look for your midwife, you look for your dietitian, you look for everybody that's going to make your pregnancy very easy. Until the next episode, God bless you.
The Power of Women Academy is a group mentoring program for high-impact women. Women who want to change their lives and their worlds and move on to the next level. Power of Women Academy is aimed and tailored at unleashing the passion and greatness locked inside you as a woman as you walk the journey of life over the mentorship period with our team of distinguished and well-accomplished mentors from all walks of life. Our mentors are indeed destiny helpers. These mentors come to inspire you. They come to encourage you, to challenge you, to teach you, to stretch you, and to empower you. They are committed to helping you fulfill your highest potential and help you birth your wildest dreams that have been placed in you by God. For more information about the Power of Women Academy, please visit www.powacademy.co.za, or for inquiries, call 064 200 1545.